Hello, now that you have completed general TouchWorks training, let's go into Scribe training a little bit further and what you will be doing to document for your providers. When you're on your daily schedule, we're going to work for Dr. Michael Denda today. I also have my providers set up here at the top. This would be very helpful for those of you who work for several different providers to save those as your providers. That way, it is an easy place for you to navigate back and forth to the provider that you are working for that day. So once I choose Dr. Denda, I will then see his schedule for that day. Patients, when they are roomed by the nursing staff, the note will be started for you. So you're going to find your note that is started here in the second column. And I'm going to go ahead and select that note that needs input. And again, for today's purposes, we are going to use Dr. Denda in a family medicine established patient visit note. I know many of you will work in various departments, but notes should be set up generally about the same. So the first section of the note on the left-hand side is going to be the chief complaint. This is where nursing staff would put in what the patient is being seen for today. So if this patient is here for an annual exam, or if they are here for some kind of follow-up, they can document this here. Next down is provider documentation. This is going to be a combined form of the HPI, the review of systems, physical exam, procedure, and consents. This will be up to your provider's preference if they prefer that you type in the HPI, if they like list form, if they like full sentences, paragraph form, or if they prefer that you use the note forms provided. If they would like you to use the note forms that are provided here, so for example, review of systems on an adult, you can select the bubble, and this is going to give you your full review of systems. If you use any of the all normal buttons, just make sure that your provider did in fact see everything that you are choosing on the assessment here. Same with physical exam. And again, you can free text in these or use the note forms, whichever your provider prefers. Next section down is the assessment. This is where you're going to select any of the diagnoses that you are seeing the patient for today. Some departments may utilize recommended orders. If you are a scribe that is going to be entering orders in for your provider, it is always good to make sure that you are on the correct site for your provider. And again, that is going to show you up here in the top right-hand corner next to the gear. It shows me that I am on Family Medicine Site 20. If I needed to change that according to my provider, I can just click up here and I would be able to search for or change my site to a new one. So if you are one that is going to put in any orders for your provider, they may be listed under the recommended order section. Or you can always access your orders by going up to the lab beaker. I would update this that we are ordering for Dr. Denda. Some of you may have lab favorites built, or your providers may have favorites that they would like you to use. They can help you set those up, or your CI nurse can help you with setting up some favorite folders as well. Departments also have some favorites. So if you are a scribe going to SIU Family Medicine, you would be able to use the folders that they have created there. So if they were doing any point of care testing in Springfield and your doctor wanted you to put in a urine dip order for in-office, you could go ahead and select this order. We would perform that in office. And here it's updated to Dr. Dinda, just like we stated. There are no other bright yellow required fields. Now I'm going to save and return to ACI. That is going to take me back to the screen to order any additional testing. Or if we are complete, you can go ahead and click OK to take you back to the note. The plan section, go ahead and document in here. There is also going to be a free text box in your plan section as well. Again, this could vary from departments, but providers' choice if they prefer you to go ahead and fill out this note form, or if they prefer you to free text in this box here for the plan. Next tab down is going to be vitals. So the vitals that were taken for today's visit would be listed here. Active problems, current meds, allergies, immunizations, results data, counseling, and then going down to the attending note. So for a scribe, you're going to want to make sure you always go down to the attending note section and find where it says Scribe Services. For the provider, they will need to check these on the left-hand side. And for scribes, you will be checking one of the boxes on the right-hand side. So whether you are a virtual scribe and you will add your scribe statement, or if you are performing async and doing the recording option as a scribe, you would check that box instead. The provider may then finish up with billing and filling out their level of service. Once you are finished with your documentation, you will be able to save and close the note. Before I save and close, I do want to point out a couple other options while you are inside of the note here. On the right-hand side, you do have access to see other things in the chart. So if you are documenting and wanted to see a past note, you are able to do so on the right-hand side. Or if you're wanting to see your note output, what you have selected so far in your note, you would choose Note Output. So we did fill out the review assistance section, and then under attending note, I did add that scribe attestation statement. And you will see that here. So once you have completed your documentation, including your scribing statement, you can go ahead and save and close the note. If you have placed any orders or added any assessments, it is going to ask you to commit those changes. So here you'll see that order that we placed and the assessment that we chose. We're going to save and continue. And now our note is saved. The provider will be able to come back to their daily schedule and access the note just like we did. Now you are able to move on to your next patient.